We're going to start with a big topic, and it is dominating the headlines in many ways. So, this country's largest mental health hospital, the Center for Addiction and Mental Health, otherwise known as CAMH, is saying that police officers should not be the first responders on scene when someone is having a mental health crisis. They are now issuing a statement that, in fact, it should be mental health care workers that are responding first
Mm.
and not the police. This is obviously coming in light of several high profile cases across this country. What do you ladies make of this statement?
Well, I think most people would agree, including police officers. But there's also the other side of this when people are a risk to themselves and to others. I think it requires some sort of collaboration between mental health workers and police. And what that looks like is the big question. Is it like a police force within the mental health system or a mental health system within the police force? There's I have no idea how it's going to look, but I think however this rolls out, and it needs to roll out, that it will lay bare sort of the overtaxation of the mental health system as it stands now. If anyone has had to visit CAMH or an emergency room, Simon and I certainly have with a family member who was in crisis, and the difficulty of navigating the system as it is now, knowing what to do, what ER room to go to, where to line up, and the waiting time. Sometimes you're sent home and told to come back 5 days later or 24 hours later, in which time someone in a mental health crisis can change their mind that they want to seek help. It is so complicated. And when we have had to navigate this system, we're two white people who speak real good. Like, can you imagine going through a mental health crisis if English wasn't your first language? There's just so much here. I'm glad we're talking about it, but this is not going to be easy. This is going to take time.
It's going to take time. And when you talk about language specifically, the first case that comes to my mind is a case here in the Greater Toronto area of a 65-year-old man named Ijaz Chowdhury, who was killed by police. And his family had said just that we had called a non-emergency line because our father, who has schizophrenia, was having a crisis. They called the non-emergency line, they say, because they wanted other people, perhaps paramedics, to show up in lieu of police. And unfortunately, what was caught on video was an interaction that, at least to me, seemed very quickly to escalate from breaking into someone's unit into shots fired and somebody dead. And I think that the language barrier, in addition to so many other factors, makes me agree with you, Jess. There's got to be a middle ground. There's been so many calls for defunding the police, which I know has been a controversial issue, but I would love to know that instead of maybe calling 911, that I can call another number that has some kind of mental health crisis mobile unit, mobilize first, and maybe the backup is police. Because I don't know about you, but if I need heart surgery, I don't want a spine surgeon showing up. I want a heart surgeon showing up who knows the intricacies of what that case requires.
Mhm.
I think police would probably also be really relieved to not have to be the first person or the first team called. There's another case that happened back in April, a full 2 months before George Floyd was killed by police. It was in Brampton, and it was a 26-year-old young man named DeAndre Campbell. He called the police himself. He had been struggling with schizophrenia. He was in the house. He was having a crisis. He called police himself. According to the family, within 2 minutes of police arriving, he was dead, shot in front of his four siblings. So the family has said there's got to be another option because people are ending up dead when they are in crisis.
Yeah, it's also about, I mean, even if Mel said your analogy was, if I'm having heart surgery, you don't want a spine surgeon to show up. And I agree. I mean, for sure, in this case, you do want mental health assistance on site when distress calls are made instead of police, or maybe in combination. But it also comes down to training and when the training is applied. especially for police officers, how much mental health training are they getting while they're being trained to become police officers? I have several friends who have applied to become officers at the local level and at the RCMP level. And there isn't that much up to date, extensive prioritizing on mental health training in those programs. And furthermore, you have to also think about when if we're if we're really thinking about policing and what policing should look like and who police officers are, I also think it's worthwhile taking a look at the recruiting process for police. I know for sure that there's a psychiatric evaluation, like an interview during the interview process, and we all know, you look for certain candidates for any job, right? But in particular for police officers, they're looking for a temperament or not. They're looking for a certain set of personality attributes. I wonder, though, if that template is outdated and doesn't account for a personality
Mm.
type that is about de escalation and mental health awareness and compassion and sympathy over something else. I'd like that to be examined too. If we're really talking about the ways that policing can be more effective, and looking at the ways that police can help instead of harm.
Yeah, I take all of those points, and I think we've been talking about a solution. And as Jess said, this is not going to be easy. But I think about Carly Church, and Carly Church was on our show not too long ago. She is a trafficking survivor. And what she explained is that she works in collaboration with the Ontario Police because she has been there. So basically, if they are attending a situation where there is a trafficking situation involved. She talked about going into hotel rooms and other things. She will attend with the police and talk to the person who has been trafficked and explain to that person, listen, I know your situation because I've been there. She basically de-escalates the situation, and then the police do their job. So I'm wondering, listening to everybody this morning, if indeed it is some sort of hybrid situation. Yes, to police training with regards, to mental health and de-escalation, but also yes to somebody who has been there involved as well.